Dr. Saeed Kazmi here once again, and let's talk about congenital neonatal infections. These are infections which are acquired in utero and have consequences in early newborn life. So from practice point of view, if you are dealing with a sick newborn and you've already ruled out more common causes like sepsis and inborn errors of metabolism, and still something doesn't seem right because either the baby looks small-headed or big-headed, small in size, abnormal eyes, or the examination shows features of organ enlargement, then think of congenital infections. It's important that before you make a diagnosis, you have done investigations which are important in such a case, and they are: number one, MRI brain; number two, complete eye examination, including retinal examination; number three, deafness screening; number four, echo; number five, anthropometry. So if you've done all these, and the combination of various features from these investigations can then help you in making your clinical diagnosis. And that is, if you find macrocephaly plus hepatosplenomegaly plus chorioretinitis plus diffuse cerebral calcification on MRI, then this neonate has got congenital toxoplasmosis. If you find petechial non-blanching rash with hepatosplenomegaly plus periventricular brain calcifications on MRI, the neonate has got congenital CMV infection, which in 10% cases is, in 90% cases asymptomatic, but in 10% can be symptomatic as well. If the neonate has got cataracts, bilateral hearing loss, congenital heart defects like PDA, then this neonate has got congenital rubella syndrome. If the baby is tiny, has got intrauterine growth retardation, has generalized edema, which is also called fetal hydrops, then think of congenital parvovirus B19 infection, though this can also occur in severe thalassemia. If the neonate is tiny, has got IUGR and a cicatricial rash, some limb anomalies which are usually asymmetric, then think of congenital varicella zoster infection. And if the neonate has got microcephaly, that is small head, has got diffuse subcortical calcification on MRI brain, and has got pigmented retinal changes, then it's most probably congenital Zika virus infection. So this way, with the help of investigation and the characteristic findings that you find on those investigations, you can clinically diagnose majority of the congenital infections. So hope this small snippet about diagnosis of congenital neonatal infections helps you in your clinical practice. Stay tuned for some more content.